My name is Meredith Pothast. I am an interior designer and I own my own business called Organized Home. We do organization and listing readiness. We are here today because I was diagnosed with colorectal cancer at age 28 last March of 2018.
Bruce DeArt, a 19-year veteran of the Jeffersonville Fire Department. I have two daughters. I have a 21-year-old and a 16-year-old. And so my life, family first and work. I mean, I love my job. I love the career, love helping people. We're here to discuss my diagnosis of stage 4 colon cancer.
My name is Whitney Jones. I'm a gastroenterologist, and I'm also the founder of the Colon Cancer Prevention Project. Various guideline groups recommend different ages for screening. Normal risk individuals, those people who don't have a history of polyps or cancer, will start at either 45 from the American Cancer Society or at 50 from the United States Preventative Task Force Service. The American Cancer Society, based upon modeling studies as well as data that we've seen over the past decade about the increasing risk of colon cancer under age 50, decided that 10% of the life years being lost to colon cancer occurred between 45 and 50, and they felt it was important to move the recommendation down to address that.
My name's Pam, Pam Myrick, and my daughter is Meredith Myrick, Pothast now. Impy, mischievous, adorable, the little boy in our family, we used to call her.
I had the short mushroom cut haircut when I was little, so I was always mistaken as the little boy.
Meboy, and that's where she got the nickname, part of the nickname Meb.
So we were 15 or so. I was a summer going into my sophomore year of high school, summer going into her junior year of high school. We met at a mutual friend's birthday party. I don't know what it was about her, like her aura or something, that I was just like immediately kind of attracted to wanting to talk to her and be around her.
All my girls, we wondered whether it was a good thing to go off to college with the boyfriend from high school. And then it worked out better that he went to a different college than Meredith. And they just kept in touch, and he'd visit, and she'd visit his college. And they just grew as boyfriend and girlfriend.
And we dated for 7 years before we got married, so all through college, no breakups.
And now they're married. It was a very good relationship.
Bruce Wayne DeArt, 8968.
As I said, I'm a 19-year veteran of the fire service. My rank now is I'm a deputy chief of the department over the administration. Monday through Friday, I'm at the fire station early. I get up early, get to the fire station, and work all day between meetings and working with the guys all day. And then home life is, we love outdoors. So summertime we spend a lot of time outdoors in the pool with the dogs. We just try to enjoy life as much as we can.
He's always been very independent. Doesn't need anybody's help. Very funny. He's like me, I got my personality from him. Just doesn't really care what anybody thinks of him, but is also really, generous. Most people only try to help people because they want their self-image to look good. He tries to help people because to make them feel good and them feel better about themselves and help them, not himself.
I wouldn't say that I ever walked through life thinking that I was invincible or my family members were invincible, or that, you know, I don't think these things can happen to me. But until it is you, it's absolutely surreal.
You know, statistically, 15% of colon cancers occur under the age of 50. And in my own practice, 4 of the last 10 colon cancers I've identified were under the age of 50. It's real.
Casey Sexton. I'm 37. Before I got sick, I was a respiratory therapist at Hazard ARH. I guess my favorite place to work was ER, just because it was so unpredictable. And you know, you see something new pretty much every time you're there. So I think that working in the healthcare field, that helped catch my attention early with some of the symptoms. You know, I talk to those kinds of people every day. I work with them and help them. And now here I was getting the same symptoms they were telling me about.
We think that about half of these cases of colon cancer in younger people have a clue in the family history, meaning that a first-degree relative has either had colon cancer or some type of an advanced adenoma, which is known as a big old polyp.
I was fatigued more than normal. Now at the time when I first noticed this, I was on night shift. And if you ever work night shift, you're always tired anyway.
But half of the people have sporadic colon cancer. It comes out of left field. They don't have a family history. They don't have predisposing factors like Crohn's disease or colitis.
At the time, I was a 34-year-old healthy guy. I didn't smoke, I didn't drink, no family history of colon cancer. I didn't do any recreational drug. It was just very bad luck.
20 years ago, if a young person had abdominal pain and some rectal bleeding, it would have been ascribed to hemorrhoids and irritable bowel syndrome. No longer is that the case. People need a full evaluation specifically and focused on evaluating and excluding colon cancer as a cause, and this information needs to go down to people in their 20s, 30s, and certainly by the time they're 40, they have to have this information. 45 is the finish line. It's not the starting point.
My husband Jack and I were living here in Louisville. I avoided or lived with a lot of pain for easily 6 to 8 months. I had abdominal pain, bleeding in my stools, constipation, unexplained weight loss, and fatigue. I brushed it all aside, continued to work full time.
February, was it February I think, that my mother had passed away and Meredith came back for the service, and I noticed her sitting funny. And she was sitting in the pew, kind of shifting her weight a lot. And I had said afterwards, what's going on? She goes, well, I bought a pillow for work. My bottom kind of hurts when I sit down. And I said to her, that is not the way it's supposed to be.
My mom's a nurse, or a retired RN, and so talking to her, she finally saw me and was like, something's not right, Meredith. You've complained so much about your bloating and constipation and abdominal pain. This is not IBS. This is not celiac disease. I don't think, you need to go and talk to your doctor.
You go home and you see your doctor, and even if the office closes at 5, you stay there till 10 p.m. And you stay there until you get him to give you a GI consult and you get a colonoscopy.
And that's when they found a mass. So they called us in on a Friday and told us that it was colorectal cancer stage 3C, which means they did find cancer in my lymph nodes.
I'll never kind of forget the range of emotions. First thing you hear the cancer word, and I think a lot of people's mind immediately just kind of goes to death.
Jack called me and told me it was colon cancer. And I just was like, yeah, got it, okay.
For me, I had to stay positive and strong for Meredith. I had to just keep telling her it's okay, you're gonna be fine. It's not, we're gonna deal with it. It's everything's gonna be fine. At least now we know what it is and we can deal with it. Every chance that I wasn't around her, I was essentially crying.
And from then on, it's like okay, colon cancer, now what's our next step? How do we fight this? What do we do next? Where do we go? And that's where I think we've all been really strong to try and motivated to make this go away.
She was great about just like, we'll just wait to hear what the doctor says. But the whole time I'm on my laptop just reading everything about colon cancer, what stage 1 looks like, what stage 2 looks like, what stage 3, worst case scenarios. I'm just reading everything.
Okay, this doctor said there's a mass and it is cancerous, but that we just need surgery. So let's get to that point, and then I'll be done.
My name is Dr. Erica Sutton. I'm a surgeon and Associate Dean at Morehouse School of Medicine, and I help people get access to healthcare. The type of screening that you need is based on your risk. Your risk is increased if you have a known inflammatory bowel disease or if you have a family member who's been affected by colon cancer.
I would say that traditionally we talk about a 10 to 15 year window from where a small polyp turns into a larger polyp and an early cancer and then a late cancer. So think 5 to 15, a broad range.
I had a low-grade fever, nauseous, chilling, just some pain in the lower right abdomen. So it's just what no idea. I couldn't have guessed in a million guesses that it would be what they told me.
He actually called between the CT scan and the clinic, and I think it was right around 4:30 when our day ends. And we were supposed to pick up a foster puppy that night.
So I had to drive somewhere else to the CT, and she said, "You want me to go with you?" And I said, "No, it's fine. I'll just go do the scan and I'll call you when I'm done," And went and did it. Took about an hour, time you drink the stuff and everything, and then they said, "You need to go back to your doctor." I was like, "For what?" They said, "You just need to go back to your doctor." I said, "Okay." So I called her. I said, "I've got to go back to the doctor for some reason. I don't know. You want me to meet you there?" "No, it's good. I'll just go." So I go in the room and they close the door and they said, "We've got bad news for you." And it's just like, I was by myself, but I was really by myself at that moment. It was pretty tough to hear those words.
So I walk in the animal shelter and I'm already starting to cry. Sarah Green, who works there, is a friend of both of ours, and I'm literally on the phone with her and I find out that he's got a mass.
I was 49 years old, had not had a colonoscopy yet, thanks to, insurance rules of 50.
I'll never forget when Tori got there.
I walked in the hospital room and everybody was crying, and he told me that he got diagnosed.
The next goal was to meet with oncologists, figure out what we were going to do. So we met with them. We told them we'll go wherever you want us to go. You tell us where we need to go to get this fixed, because we're going to beat this.
In general, we have an increased awareness of early age onset colorectal cancer. Knowledge is power, which means that we're able to detect and recognize symptoms earlier. And so don't let those age guidelines prevent you from talking to your doctor about new symptoms that you may be experiencing.
I think what's happening right now is the underage 50 colorectal cancer thing has been on the fringe. We are seeing the tide begin to rise. It's like a tsunami, right? It's not the big wave, it's just that rising water that's coming up. And that's why we have to be so much more proactive about educating people earlier, because we don't know the answers.
I was 34 and I thought healthy. And like I said, I didn't do anything to cause, or I didn't do anything that I know of that would cause cancer, as far as, smoking or anything like that. It's just, I was confused, and it took it about a month to really sink in that it was really cancer. You hear that word, and everybody says, "Well, yeah, I can get it." But in the back of their mind, what they're really thinking is, "I'm not going to get it," and chances are you won't. But that's what I thought too.
It's colon resection surgery, plus they do the HIPEC procedure, which is heated chemo into your abdomen. After surgery, he came out, met with my wife and family, and told them that I was cancer-free at that time. He had got all the cancer out, and felt really good about the surgery. So we spent the next 2 weeks in the hospital recovering.
But then it becomes your new routine. So every day I drove to the radiation center. You change in this little room into a robe. You lay on a table that rises, and then those lasers aim little tattoo dots, and then you're done. Those radiation lasers actually scarred my pelvic area and left almost like a sunburn feeling internally.
Then we did more aggressive chemo called the FOLFOX, and that came with all the standard side effects like the neuropathy and the vomiting, tiredness, all that. So the treatment, it wasn't really responding the way we were hoping with the treatment.
They found a small spot on my liver that concerned them, so they decided to put me back on chemo again. It worked so well the first time, they said, we'll do this again.
Every day I'd actually leave work and drive over around 3 p.m. I'd keep my little session for the radiation appointments every day, and that was Monday to Friday. And then alongside all of that was the chemotherapy, which I had a port placed under my skin, and that would be for all the chemotherapy infusions.
So then we started moving into the immunotherapy part of treatment. The first thing we tried was Avastin, and the way Avastin works is it tries to cut off the blood supply to the tumor. It just didn't work.
Scheduled me for a liver ablation to get the spot out.
They actually would hook me up to a chemo ball, and I would wear that in a fanny pack from Monday to Friday. And so by Friday, the ball was completely shrunk, and they'd remove it. And so that was every week my favorite day.
So I got referred to Marquis Cancer Center in Lexington. At this point, 5-FU chemo failed, FOLFOX failed, and Avastin, they all failed. So 3 different types of chemotherapy failed. So they basically told me at Marquis that they could buy me time. And that's, that's, at that point, that's the most they could do is buy me time.
But in the meantime, a spot had popped up on my sacrum that they were concerned with. So they ordered a biopsy. And so I went and had a biopsy done and confirmed that it was, but it was caused from the colon cancer, so it's nothing new.
Everyone sees the outside of him, and they see him when he's feeling good, which thankfully is quite often. But they don't see when he's not, and they don't see, they go into the bathroom literally every 15 seconds, and the gasping out loud in pain.
When you see them go through something like that hurts them, it's definitely like you're confused. You don't understand why that's happening because you think nothing can hurt them.
You would get the neuropathy in your fingers, in your throat. I couldn't drink anything cold. But I never complained. I just tried to live every day just like I always have.
And just so many doctor's appointments, so many treatments, the surgery, being in the hospital for 4 nights, just constantly being in waiting rooms, in doctor's offices, and taking notes and trying to learn everything I could.
We have been monitoring 2 nodules in my lungs throughout treatment. They appeared in my CT scans ever since I was first diagnosed. Well, 1 nodule did. But it wasn't anything that my doctors were really worried about, so it didn't worry me. I just let it stay in the back of my mind. But in the last several months, a 2nd nodule has appeared, and my oncologist here in Louisville began to worry.
Cancer is really good at hiding what it is. It's good at making itself look like a normal cell. So the immunotherapy, it kind of causes the cancer cells to hold up a white flag to show what they really are. So then my immune system can see it, can target it, and attack it. And since we started Keytruda, each scan has gotten better and better and better. And the last PET scan that I had showed that there was no evidence of disease at all. So as of right now, I've gone from early stage 4 to complete remission.
Well, there are tests that you can take home now. And so you can simply ask your provider if you should take that test. And if you should, they can send you home with the kit or send a kit to your home. You can do that in the privacy and comfort of your house and send it back in through the mail.
The first thing I'd say about colonoscopy is the ultimate diagnostic tool for a person who has symptoms. Colonoscopy helps detect polyps at their smallest stages. So small polyps, 3 millimeters, 4 millimeters, the size of a BB or a pea. And those are almost never malignant or cancerous. People take a PrEP the day before. They're getting better than ever, smaller than ever, but nonetheless, a person will have multiple bowel movements. They can stay on clear liquids and have some other things. Then the next morning they come in, they meet the anesthesiologist, they get an IV, they get medication in order to cause them to not have any memory, certainly no discomfort. And then the small scope, about the size of your little finger, is inserted through the rectum, and it goes all the way around the colon to the very last part over here on the right lower quadrant near the appendix. We like to visualize our landmarks. Then it's slowly withdrawn as we look for polyps or other abnormalities in the colon, which could be either causing symptoms or, if a screening colonoscopy, looking for signs of polyps or cancer. It's an amazing way to examine it, and it's certainly been shown to reduce mortality and prevent colon cancer. I mean, it's a very effective examination.
Colon cancer caught early is curable. That's important because you don't want your fear to put you out of reach of a cure.
15 years ago in Kentucky, physicians didn't recommend it and people didn't know about it. That's really not the case anymore. I think a lot of people put it off because they don't have symptoms, they don't necessarily have family history, or they don't know their family history is quite common as well. And it's one of those things, you know, if it's not broke, don't fix it. And I think a lot of myths remain that if people find cancer and you identify it, it's a death sentence. And that's in fact not the case. It's quite the opposite. Finding colon cancer early in stage 1 and stage 2 can lead to a 90% survival rate.
We do want you to stay in the fight because along the way, you have a lot to give and a lot to get from being in that fight. You can give hope, you can give encouragement, you can get hope and encouragement from being in that fight.
In the 4 months since we spoke last, there's been some movement that we've done. We've actually went to MD Anderson in Houston. I was able to get on the same medicine that is in the trial, and I'm able to do it here. It's a pill plus immunotherapy drip that we're doing. It's a 6-week plan. So far, side effects have been minimal. This is to control the cancer from growing. It's not going to kill it. It's just going to control it. But this is a new study they're doing that seems to be working on some patients. So in the meantime, during that time, I had a spot that was on my sacrum that had came up, and since we went to MD Anderson, I have gotten, after the holidays, I'd gotten 5 treatments of radiation to take that out, and that I was in severe pain and in the hip area. So that was alleviated with the 5 treatments. So that's gone. We are in the stages of controlling what is in me, and I treat this more of a chronic disease, I think, just for the fact that for my mind to know that this is something I'll be dealing with for the rest of my life, more than likely. I'll feel better than I felt in a few years. I'm coming up on my 2nd anniversary of my diagnosis, March 19th. So for Colon Cancer Month, that's kind of fitting, I guess. So, but during that time, I've done a lot of advocating for early detection, and I've got to work with the American Cancer Society with the state of Indiana to lower the age to 45 from 50 for colonoscopy, and that's waiting to get signed this month by the governor, so hopefully that happens this month. And so just, like I said, living life every day, and I think God has a plan for me.
The last time we spoke, I had just gone through lung surgery. We found out that the spots in my lungs were the colon cancer that had metastasized. I was told by my team that when you have stage 4 metastasized disease, there's no true cure, so you are indefinitely receiving treatment until your tumors are gone or your cancer is gone. I know within the last year and a half, I know at least 4 people that have reached out to me because of my story have went and got a colonoscopy and had polyps removed. And that's huge. So I hope to keep saving lives that way. I'm really honored. I'm excited to speak, share my story with others. Again, it's happened to me, so I want to get my story out there and hopefully be inspiring to other people that have symptoms, need to know where to go, what to do to get screened, or how to handle if they were diagnosed.
I have a new sense of confidence that with my dedication to lifestyle, diet, and nutrition, I will beat this disease and live a long, healthy life.
I told my parents I just want to make them proud, so, which they continue to tell me I do, but I think by standing in front of 300 people and standing up there and having the courage to tell this crazy story, I think is needed, so.
Thank you so much for your kind attention tonight.